Welcome back, Dr. Naveen here from UPSC MEDICO. One of the important topic for any PG entrance examination or for UPSC CMS, or let's take it as even medical science optional from healthcare point of view during the interview related stage also, you need to understand the latest Indian Public Health Standards, that is IPHS 2022 guidelines. So among these guidelines, the most important topic of our discussion is the population norm. Okay, you might have seen in many MCQs or even during Viva, what should be the ideal population for one sub health center or one primary health center or one community health center, right? So we'll be looking in that lines. Before getting into the details, as per Indian Public Health Standards, the health system, the public health system in India is classified into the first basic unit is a sub center. From there we have a primary health center. From there we have a community health center, which is a referral center, first referral center, and from there we have a sub district or SDH or district hospital, sub district hospital or district hospital. So this is the hierarchy starting from the sub center. So before IPHS 2022 came into existence, these IPHS 2011 guidelines, according to that, we do not classify them into rural or urban areas, but the major change with IPHS 2022 is, the recent change is, now we have rural and urban in each category. Okay, this is the first take home for you, rural and urban in each category. As you could see, one more major change what happened in 2018 after the National Health Policy 2017 is released, and in 2018 we have Ayushman Bharat. According to Ayushman Bharat, along with Ayushman Bharat, along with the health scheme PMJY, right, Prime Minister's Health Insurance Policy, there is another development called Health and Wellness Centers. Okay, so this health and wellness centers, what are these? Both sub centers and primary health centers in India are now modified into health and wellness centers. The main aim being to make them a comprehensive healthcare centers. Okay, to make them comprehensive healthcare centers. So these two basic prerequisites or understandings are very important to proceed further. What is the first important basic thing? That as per 2022 guidelines, we have introduced rural and urban under each category of the public health system. The second thing is, now the sub-centers and PHCs are called health and wellness centers as per 2018 development after the National Health Policy 2017. Right. Now let's get into the main topic of discussion, that is, what is the population norm for health and wellness center, that is sub-center. Okay, where sub-centers, we have two types of sub-centers. One is urban, which is in the urban health and wellness center. The other is rural side, we still call it as a health and wellness center, which is a sub-center. Now, because it is catering to the rural areas, we still see plain population and people who are living in the tribal population. Now in the plain population, the population norm is for every 5,000 people there should be one sub-center. Whereas in tribal or hilly areas, for every 3,000 people there should be a sub-center. With regards to urban, the urban itself is a plain area, right? So the urban health and wellness center can cater to a population of 15,000 to 20,000. This is regarding to the sub-center. Okay, then comes the primary health centers. Now the primary health centers, as per 2012, okay, in comparison to 2012, in 2022 we have classified into rural and urban, as I already told you. Now we have three things here. We have rural ones, we just call them as health and wellness centers, PHCs. We have urban ones, which we call them as urban health and wellness center, PHCs. There is a new introduction, new terminology. In the urbans, we also have a specialist urban PHC, that is polyclinics for specialists. This is only OP basis. Okay, this is only outpatient, not admissions. Admissions will always happen in the referral center, that is community health center. But here, this polyclinic services are limited to outpatient care. So the same PHCs, now we have rural, urban and polyclinics. So this is the basic introduction. Now let's look at the population norms. Population norms for rural PHC in plain is 30,000. These are all important MCQs. Okay. In hilly and tribal areas, it is 20,000. As I'm talking about urban, 50,000 is the plain population. There's no tribal areas in the urban region, right? So polyclinic, it is 2.5 to 3 lakhs. Polyclinics cater to 2.5 to 3 lakhs, and this is only OP service, outpatient service. Now next comes community health centers in the chronology, right? We are done with the sub-center, we are done with the PHCs. Now we have community health centers. Community health centers are the first referral units, right? Some of them can be referred in the rural areas. Some of can be like lying in the rural and urban. So first and basic classification is, let me take a pen. When you have a community health center, it can be a first referral unit that you can refer, or it can be a non-first referral. You cannot refer a patient. Okay, there are no facilities for referral as such. In the referral part, you have both rural and urban, okay, CHCs, okay, rural or urban CHCs, whereas the non-referral part only lies in the rural areas, okay, only lies in the rural area. Why this distinction is important? Because in non-FRUs, okay, in non-first referral units of community health centers, the population norms are 80,000 for hilly and tribal areas, 80,000 for hilly and tribal areas, whereas it is 1,20,000 population in plains. Okay, whereas in FRUs, that is first referral units, both in rural and urban. Okay, when I say it's rural and urban, now we have either it's a metro or it's a non-metro. When it's a non-metro, the population catering is 2.5 lakhs. When it is a metro, the population that it should cater to is 5 lakhs. So this is for community health centers. The next in the chronology is a district hospital, a district or sub-district hospital. As per the norms, this is very important. Every district should have 1 bed for 1,000 population. 1 bed for, in the hospitals, public health hospital, there should be 1 bed for 1,000 population. This is the essential criteria, but desirable, the new is 2 beds per 1,000 population is desirable. At least there should be 1. If possible, 2 is desirable. Okay, 1 bed per 1,000 population is essential. 2 beds per 1,000 population is desirable. Now, for how many population it caters, let's get back to that. If the population is less than 5 lakhs, okay, 1 functional DH is enough. Okay, if the population is in between 5 to 10 lakhs, okay, we need 1 district hospital plus 1 sub-district hospital. For every additional 10 lakh population, we need plus 1 more SDH. Okay, depending upon how much is the population is. So for less than 5 lakhs, 1 district hospital is enough. If the population is between 5 to 10 lakhs, we should add 1 more sub-district hospital to accommodate the patients. If the population is plus add on 10 lakhs, for every 10 lakhs of population, we need an additional sub-district hospital. So these are the population norms as per Indian Public Health Standards 2022, and very important.